Center for Excellence in Hip Disorder, what it really means is a dedicated center to provide the best state-of-the-art care for children with hip disorders.
And the goal of the center is to gather all of us together who are involved in treating children with hip problems and work with our genetic people and work with our other researchers to learn as much as we can about a number of different hip disorders.
The Hip Center here really allows for a group of all hip surgeons that specialize in different aspects of the hip to come together and make some decisions on some of the kids that are very complex.
Why not have your nurse talk with them?
We're continuing to search for new and better ways to do things, new and better ways to treat patients, which makes it that much more sort of state-of-the-art sort of care.
And we're interested in really all the spectrum of hip disorders, dislocated hips in children, injuries to the hip, growth problems in the hip.
So believe it or not, you think hip problem is really for old people that need hip replacement because they have arthritis, but it could start from day one. And hip dysplasia could be diagnosed right after birth to when you're adolescent. It's one of the more common because it affects 1 in 1,000 births.
So there's many causes of why adolescents will have hip pain. Many of them are developmental. Some they're born with, some are traumatic, and some are sports related, or you could consider it a repetitive use type injury.
As you move up the age, we have disease like Perthes disease. It's also called leg cavity Perthes disease. Grady is a very active 7-year-old from San Angelo, and he developed hip pain. And he was seen by a pediatric orthopedic surgeon, and he was recommended to have a pelvic osteotomy, which is one of the standard treatment for Perthes disease. But parents wanted to have a second opinion just to see before they undertake this big surgery that it was really warranted. One of the things that we developed and pioneered here is this new imaging method called perfusion MRI. So we ordered that MRI, and when we actually saw the results of it, we were actually surprised at how much of his femoral head has already healed. And initially we had him scheduled for surgery, and we changed our mind based on this advanced MRI imaging method. And we treated him with Petri cast, which is also a traditional treatment. How you been?
Good.
Yeah.
We came here talking to Dr. Kim about everything. I mean, we felt comfortable that this is what we need to do, and we really felt comfortable he was the best person to do it.
First of all, it's important to know, children may not complain about hip pain. They're not very specific. They may have knee pain or thigh pain, and sometimes when you go to your primary doctor, they may examine the knee and get x-rays and even MRI and find there's nothing wrong. It's actually, it's the hip that's the source of the pain and the problem.
Maximizing a patient's strength is really important to protecting the hip, and oftentimes just maximizing their strength is enough to alleviate their symptoms.
You want to touch your foot on the ground.
In a clinic like this, it's not just a doctor who specializes in it. We also have therapists, nurses, and research coordinators who are familiar with the condition.
What the Hip Center does is it allows surgeons with different expertise around the hip to come together to come up with really a collective decision for a certain kid, and in my instance, sometimes for a certain athlete.
We have someone like Dr. Sacato and Pedazwa that does complex osteotomies, and we have someone like Dr. Ellis who could do a very kind of refined, minimally invasive type of procedure, but it depends on the problem, and it depends what would be the best.
One of the reasons we have a Hip Center and has set our institution apart has not only been our clinical expertise, but our research expertise.
And at Scottish Rite, we do research not for the sake of doing research, but really how can we improve the treatments and come up with new treatments for the patients that are walking through our doors now.
And we do that in conjunction, again, with a multidisciplinary approach here at Scottish Rite, using our gait and motion analysis lab to help us understand the complex nature of these things and what we do, how it affects patients.
We want to avoid hip's wearing out with time. So we're going to try to do things to preserve the hip. So we want to create as normal hip as we possibly can, so that by the time they leave here at 18, the likelihood of them having a hip replacement is as close to zero as possible. That's ultimately our goal.
So I'm gonna discontinue the brace. You don't have to wear the brace anymore at night. Is that good?
What about a day?
You want a days? No brace.
No brace.
No brace at all.
I would say coming here and being involved with Scottish Rite, there's a peace about it because you know that they're doing the right thing and they're going to do what's best.